Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
RSV cases have put hospitals into crisis mode here in Oregon and across the country. The common virus that just about everyone gets as a child is hitting extra hard this year, combined with flu season and COVID.
Well, people need to recognize it's not new. It's been around for decades. We've been treating children for RSV for many years.
Virtually all children get an RSV infection by the time they're 2 years old. Most of the time it causes a mild cold-like illness, but it can become more severe, causing bronchiolitis and pneumonia.
The reason why we're seeing such an increase this year is because of the pandemic. A lot of kids weren't exposed. They were kept at home, they weren't taken out to stores, and so they just haven't been exposed. And now that we're opening up our communities, a lot of these young kids are getting exposed for the first time.
So what is RSV? RSV stands for respiratory syncytial virus. It's a common respiratory virus that usually causes those mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults. RSV is the most common cause of bronchiolitis and pneumonia in children younger than 1 in the U.S.
If a child is infected with RSV and they start building up mucus, they can have problems because their airways are a lot smaller than those of adults. This is one of the reasons why children are much more susceptible to having a problem with RSV.
It can also become severe in older folks and people who are immunocompromised. Remember to keep up on hand washing and stay home if you're sick. And Dr. James Polo has this reminder for parents.
So now that kids are back in school, now that we're kind of getting back to more of a social life, it's important to get those kids back into their pediatricians and make sure they're up to date on their vaccinations.
For more information and updates on the RSV crisis in Oregon and Southwest Washington, visit kgw.com/healthiertogether.